All right, let's dive into something that can be, well, a real headache for a lot of us: health insurance. Today, we're going to demystify the whole thing and hopefully turn all that confusion into some serious confidence. Does this look familiar?
Yeah, I thought so. If you've ever felt completely buried and overwhelmed by all the options, you are in very, very good company. But it's more than just a feeling. Getting this wrong can literally cost your family thousands of dollars every year.
And the stakes? They are incredibly high. I mean, look at this number. This is why we're talking about this. Without any insurance, just one single trip to the emergency room could easily cost you more than $3,000. And that's not even counting a hospital stay, which could run you into the tens of thousands. So let's treat this like we're solving a puzzle. First things first, we've got to put the corner pieces in place, which means understanding what health insurance actually is and why it matters so much. At its most basic, health insurance is just a contract. It's pretty simple, really. You pay a fee every month, that's your premium, and in exchange, the insurance company agrees to help pay for your medical bills when you get sick or hurt. You can almost think of it like a subscription service for your financial safety. And this right here, this is the whole point. Health insurance isn't really about covering a routine checkup. Its most critical job is to act as a financial shield. It's the one thing that stands between a medical emergency and a total financial disaster for your family. Let me give you a real-world example. Imagine a family tries to save some cash and skips getting insurance for the year. Then, boom, their kid breaks an arm. You've got the ER visit, the x-rays, the cast, all the follow-up visits. It all adds up to $6,800 out of pocket. That single accident costs way more than a full year of premiums on a really good plan. Okay, so you're paying this monthly premium. What are you actually getting for your money? Let's decode what's in your coverage by looking at what most plans are required by law to cover. These are what's known as the essential health benefits, and they are the absolute foundation of any legitimate health plan. It means your plan has to cover the big stuff you see here. We're talking hospital and emergency care, doctor's visits, prescriptions, mental health services, even maternity and newborn care. It's designed to be a solid baseline of coverage for everyone. So now we get to the really practical part. How do you pick the right plan for you? And I'll tell you the most important thing right now, it is about so much more than just finding the cheapest monthly price. This is the big trade-off, the number one thing you've got to wrap your head around. See, a plan with a really low monthly premium almost always has a super high deductible. And that means you have to pay a lot more money out of your own pocket for care before your insurance even starts to chip in. So if you have a family or you have regular medical needs, paying a little more per month for a lower deductible plan could actually save you a ton of money in the long run. In this one, oh man, this is critical. You have to check if your doctors are in network. Don't ever just assume they are. If you go to a doctor who isn't in your plan's network, the insurance company might just refuse to pay at all, and then you're stuck with a surprise bill for the entire amount. Okay, now this number might just be the most important one on the whole plan, and it's the one so many people ignore: your out-of-pocket maximum. Seriously, think of this as your ultimate financial safety net. It is the absolute hard stop most you will ever have to pay for covered medical care in 1 year. Once you hit that number, your insurance pays 100% of everything else. All right, so we know what to look for, but just as important is knowing what to avoid. So let's run through the 5 most common and costly money traps people fall into when they're picking a health plan. Let's just run through these because getting them right can save you a small fortune. Number 1. Don't pick a plan just because it has a low monthly premium. Number 2, always check that your doctor is in network. 3, know your open enrollment deadline. That's the one time of year you can actually sign up, and don't miss it. 4, understand your out-of-pocket max, your true safety net. And finally, number 5, if you take medications, double check that your prescriptions are actually covered. And hey, you don't have to just take my word for it. Listen to this health insurance advisor. He says the biggest mistake he sees over and over again is people getting lured in by that cheap monthly payment without having any idea what a massive deductible could do to them after just one trip to the hospital. So let's tie this all together. If you take away just one thing today, please let it be this: the best health insurance plan isn't the one with the cheapest sticker price. It's the one that actually fits how you and your family really live your lives and use healthcare. And that kind of leaves us with one last question for you to think about. When you look at your own insurance plan, or when you get ready to pick a new one, you have to ask yourself, is what I have a real safety net? Or is it a financial trap just waiting to spring? Knowing the difference, well, that's everything.